Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. My dear students, today I'm going to talk about foreign bodies of the nose. Well, one should know first of all what a foreign body is. Now, foreign body is something, a foreign body is an object which is found in a location it does not belong to. Now, in order to explain it, I have to give you an example, and that example, like say for instance, food particles in food, bones, meat, loaf of bread, these are the things which are natural to the food passage. If they are present in the food passage in the course of swallowing, this is not a foreign body. But if food particles are found in the airway, in the trachea, in the bronchi, or in the lungs, then you call it a foreign body, because food and food particles do not belong to the airway. Similarly, one can say that a plastic button or a metallic foreign body does not usually belong to the airway or the food passage. If a metallic screw or a plastic button or a stone is found in the airway or the food passage, we call it a foreign body. Now we come to the classification of foreign body, and just we're going to talk about the foreign bodies in a little detail now. Bismillahir Rahmanir Rahim. Nasal foreign bodies. By definition, a foreign body is an object which does not belong to the site where it has been found. Talking about foreign bodies in the nose will commonly occur in children between the age of 2 to 4 years. Patients are usually brought to the hospital emergencies, also seen in adults who are mentally retarded or suffering from a psychiatric illness. Foreign body nose is potentially dangerous and can prove fatal if it dislodges from the nasal cavity into the tracheobronchial tree. Now, how do we classify foreign bodies? As far as the classification is concerned, one can subdivide the foreign bodies into two types: either organic or inorganic, or animate, inanimate. Organic is the matter which is found in living type of foreign bodies, such as bones, meat, seeds, vegetable matter. These are all organic. Inorganic, which do not contain the hydrocarbons, whereas organic matter contains hydrocarbons in it. If we classify the foreign bodies by animate, inanimate, that means animate are those type of foreign bodies which can move on their own, whereas inanimate type of foreign bodies cannot move on their own. So if we subclassify foreign bodies by this animate, inanimate classification, in the animates one can have maggots, worms, insects, whereas inanimates can be vegetable type of foreign bodies like betel nut, we call it CHAALIA, and peanut, or peas, or beans, or nuts, melon and watermelon seeds and date seeds, etc. In the mineral type of foreign bodies, we're again inanimate. One can give examples of metallic pins or screws or button batteries. Then the plastics are also inanimate, such as toy parts, rosary beads, and buttons. Whereas miscellaneous type of foreign bodies under the inanimates can be cotton swabs, paper, sponge, rhinolith, pebbles, rubber, marbles. And these are pictures of certain types of foreign bodies like betel nut, like plastic beads and peanuts and button batteries. Now, among all the foreign bodies, the common ones are usually the most common type of foreign body is in our country betel nut, or also called CHAALIA. And the next most common is peanuts, whereas peanuts is the commonest type of foreign body in the Western world. Now, betel nut, peanuts, pebbles, beads, marbles, peas and beans, whereas maggots, metallic screws, button batteries, slate pencils, beads, rhinolith and paper wards, etc. As far as button batteries are concerned, it's a serious type of foreign body which can result in severe destruction of the nasal septum. These button batteries are composed of various types of heavy metals such as mercury, zinc, silver, nickel, cadmium, and lithium. Liberation of these substances causes various types of lesions depending on the localization. Well, it causes intense local tissue reaction and liquefaction necrosis. As a result, they can cause septal perforations, synechia, constriction, and stenosis in the nasal cavity. This picture of a button battery inside the nasal cavity, whereas the next picture is of a button battery X-ray inside the nasal cavity. Now, consequences of foreign bodies. As far as inner type of foreign bodies are concerned, infection and inflammation of the mucous membrane, granulation tissue formation, and ulceration of mucosa. Necrosis of bone or cartilage can also occur. Whereas vegetable type of foreign bodies usually absorb water and swell up, evoke brisk inflammatory response. Symptoms of foreign bodies, usually in a child, one can say it's pathognomonic, like unilateral fetid discharge, mucopurulent or blood-stained, unilateral nasal obstruction, pain in the nose, nasal bleeding, and excoriation of nasal vestibular skin. When local examination is carried out, it's the main diagnostic tool. Usually the foreign body is manifest and one can see it easily. Sometimes it's pushed far beyond the usual visual field and it can be recovered from the posterior part of the nasal cavity or the nasopharynx. So, object mostly found beneath the inferior turbinate or anterior or middle turbinate, whereas it causes edema of the mucous membrane as well, and blood-stained fetid nasal discharge. One should also visualize tympanic membrane for acute otitis media, and one should assess the patient for any signs of sinusitis as well. These are pictures of patients with foreign bodies. Now, one picture on the top left shows excoriation of the nasal vestibular skin due to foreign body. And the other picture is of a plastic part which is found in the nasal cavity. Another picture on the right top is of a plastic ring which is being removed. Now, the lowermost left shows a vegetable type of foreign body like a seed which is being removed from the nasal cavity. The central picture in the bottom shows a rhinolith. It's an X-ray or CT scan of a rhinolith in the nasal cavity. Now, nasal myiasis or maggots in the nose. These maggots are larval forms of flies, Chrysomia, attracted by foul-smelling discharge, which occurs sometimes in adults as well, like atrophic rhinitis or encephalitic patients or leprotic patients or infected wound in the nasal cavity. Now, patients present with intense irritation, sneezing, lacrimation, headache, epistaxis, and foul smell emanating from the nasal cavity. Maggots can cause extensive damage to the nose or sinuses, can also cause damage to the soft tissue of face, palate, and eyeball. Even death can occur from meningitis in cases of nasal myiasis. Whereas a rhinolith is a special type of foreign body. A rhinolith is a stone which is formed inside the nasal cavity. It is an irregular thorny surface which embeds itself partially into the mucous membrane of the nose, usually forms around the nucleus of a small exogenous foreign body or a blood clot or inspissated secretion by slow deposition of calcium and magnesium salts. Now, how do we investigate a case of foreign body? Now, usually, if the foreign body is obvious, on clinical examination, we don't need to do any sort of investigation. It's obvious and one can most often remove it in the clinical situation. Whereas if a foreign body is not visible or is difficult to see, then one goes or opts for nasal endoscopy. One also asks for X-ray, which may reveal a radio-opaque foreign body, whereas CT scan of nose and PNS are also helpful. Differential diagnosis of a foreign body of the nose can be due to neoplasm, which can get infected, or surface of the neoplasm getting infected and causing a blood-stained foul-smelling discharge, which should be differentiated from a neoplastic growth. Whereas unilateral sinusitis can also cause a discharge from the nasal cavity unilaterally. Whereas unilateral cranial atresia also gives rise to a unilateral nasal discharge, which should be differentiated from a nasal foreign body. Now, how do we treat foreign bodies? Most foreign bodies that usually occur in children, and children usually at home. If a parent finds out about a foreign body which child has just recently put inside the nasal cavity, it's visible with the naked eye, then one can try this positive pressure technique to remove the foreign body at home. And that technique, one has to tell the kid that the parent is going to give them a kiss. instruct the parent to form a good seal on mouth and then blow into mouth while occluding unaffected nostril, which is being shown in the picture. It has a very low risk of barotrauma, similar to a sneeze, but sometimes it does lead to removal of a foreign body by this method. Now, inanimate foreign bodies, when a child is brought to a hospital or a clinic and its foreign body is visible, then one usually attempts to remove the foreign body in the clinic. But the first and foremost thing for a child is to be held strictly in an upright position. If that is possible, a child is not restless, and the child is cooperative, then it's easier to remove a foreign body. So the first thing is the child is restrained in upright position. Then sometimes we can add a few drops of nasal decongestants to visualize the foreign body a little better. Proper suctioning to visualize foreign body also sometimes helps. And a curved hook, like shown in the picture, is passed beyond foreign body and gradually drawn forward, and foreign body removed completely that way. Whereas one can also try using a Fogarty catheter, like shown in the picture. This catheter, it's an additional method. In addition to the probe method, one can try catheter method. In this, we ensure that the balloon is intact. Catheter is placed beyond the foreign body. Balloon is then inflated. Then the catheter is withdrawn through the antennae, pulling the foreign body out. Now, certain children do not allow us to remove the foreign body in a clinical situation. In those cases, we go for a general anesthetic, and there are certain indications for general anesthesia in those patients, such as uncooperative and very apprehensive patient, or if there is troublesome bleeding, which one anticipates if the foreign body is posteriorly placed with risk of pushing it back into the nasopharynx, or if a foreign body is strongly suspected but could not be seen on anterior rhinoscopy, and or it's radiolucent. Now, how we remove the foreign body under general anesthetic? Patient is anesthetized with a cuffed endotracheal tube, pharyngeal pack placed. If foreign body is placed posteriorly, patient's position in rose position and mouth gag applied. Rose position is the patient is usually supine with a sandbag under the shoulders to raise the shoulders. Now, palate is generally retracted with a catheter, which is placed through unaffected nasal cavity. Foreign body is pushed from anterior into the nasopharynx and picked up with forceps. What is the management of animate type of foreign bodies such as maggots? Now, maggots are difficult to treat. They usually, when they're alive and moving about, it's impossible to catch a maggot with the forceps because they're slippery. So one has to go for a certain method in order to immobilize these maggots. And how do we immobilize the maggots? We first of all remove the maggots after placing cotton pledgets soaked in 25% chloroform water or turpentine oil, which usually either immobilizes and paralyzes the maggots or sometimes leads to their death. Now, isolation and broad spectrum antibiotics and analgesics are also needed in these cases, and good nourishment is also necessary, whereas certain vitamins, iron supplements are also given, since a lot of maggots usually lead to anemia in children, and patients may be anemic when we see them, and injection tetanus to prevent tetanus, and alkaline dischings to wash the nasal cavities of the remains of the maggots. Well, primary causative factor is taken care of that way. Whereas removal of rhinolith is a different matter. Rhinolith is an immobile foreign body which keeps on increasing in size, and if it's small in size, then one tries to remove the rhinolith as a whole under local anesthetic. But if the foreign body is large, one goes for a general anesthesia. And if it's large, it is crushed into pieces and removed piecemeal through anti-ANAES. And if a rhinolith is very large or colossal, it is removed by lateral rhinotomy. Thank you very much.